Yes, I do remember our conversation of me and us saying that, yeah, I would talk about Black population. And so I forgot part of that. But so what I do want to focus on is Black population, but more specifically BIWOC with emphasis on Black. So BIWOC, for those who, I imagine everybody maybe knows that acronym. So Black, Indigenous, Women of Color. My work focuses mostly on women of color with major emphasis on Black identified women. So I figured I would share a bit about my journey and then talk about the work that I do with BIWOC community, more specifically Black women um, in the university setting. And so I'm also going to talk a bit about university community as well as just community organizing and how our fields train us for that, as well as what that work looks like. So a bit about me: I'm an assistant professor in the Department of Psychology, also affiliate faculty in Women's Studies. And you'll see me looking down because I can easily go off on a tangent. And so I need to have bullets just to make sure that I'm organized. So affiliate faculty in Women's Studies. And so quick disclosure, and you'll see why here in a moment when I talk a bit about my journey. I am currently not licensed. So prior to coming to Xavier, I was working at Loyola, Maryland, doing supervised hours. So I just finished my postdoc. I finished my internship at the University of Illinois in Chicago at the Counseling Center, then quickly went into a postdoctoral fellowship where I got to focus on working with Black women in the counseling center, survivors of sexual violence, doing a lot of community organizing. During that time, Black Lives Matter was happening, in 2012, but then big boom started taking place. So when I was in Baltimore, I got involved in that work and was doing community healing circles and Say Her Name. So the focus on Black women and bringing attention to that was happening. And so a lot of my work was around that, thinking about that clinically and working with people in the community clinically, as well as in the university setting. And so that also lended itself into me working with college students. So during that time, the demands from universities was coming out. So it all took place in Mizzou when students got together and brought attention to the administration that the structure here at Mizzou and many institutions is framed in white supremacy, and we want to see some changes. And so that then started traveling into other universities. So in addition to the work with Say Her Name, Black Lives Matter, I also started working with students to mobilize and engage grassroots movements to get their university to hear their concerns. And on the back end of that would be meeting with students individually to talk about racialized trauma, gender-based trauma, all of those things in the counseling center because I was a staff clinician at the time being supervised. So finished postdoc there, did a year of staff clinical work, and I'm trying not to use colloquialisms here, but the block got hot essentially. And so I, I was doing work that administration was not very happy about. And I was gonna continue to do that because that's just kind of what I feel called to do, but I really wanted to teach. I got into my PhD program knowing that in addition to practice, I wanted to teach, and I wanted to teach in an HBCU, and I wanted to live in New Orleans. And so the position at Xavier came up, and I said, bye Loyola in Baltimore. And that was during the time when I was about to sit for the EPPP. And so I got to Xavier and kept postponing and kept postponing and kept postponing the license exam because it was a lot to manage at first, being new and junior faculty and getting ready to take the exam. So I'm now in a place where I find my rhythm and I'm nearing those steps where I can finally sit for the exam and feel very comfortable with it. But so I guess the lesson in that is not to postpone. If I could say anything, to don't postpone. But anywho, so that's where I was coming from. And in that time, so at Loyola, at UIC, at KU, some of the counseling centers that I've been at. I also did work at community mental health and community centers. Where else? VA hospital and some other places where we got to engage with the community. And so doing organization with the community, working with partners in the community, stakeholders. So that may mean students, other clinicians, professors, academic researchers, community persons that are there because everybody brings expertise to figure out what community organizing and how to create these healing spaces could look like. So that's where my work came from. And that's what I still continue to do, even though I'm teaching full time. So I wanted to talk to you about what that's looked like while I've been here. Um, so I think the lessons that I've learned have been plenty, but let me tell you more about the groups. So the groups that I have been a part of or have had the opportunity to work to create while at Xavier and before Xavier have been communities such as like a Women of Color conference. And back then it was more so referred to as Women of Color than BIPOC or BIWOC conference. Sister to sister groups, what else? So here at Xavier, I've worked with persons, mostly students and another colleague of mine to create a space called Trust. And so all of these spaces are defined as affinity spaces, or some might say that they're caucus spaces or intra-community spaces. And so affinity means that only persons with those identities are allowed into that space. It's a safe space. So in psychotherapy, when I'm doing like a women of color counseling group, the role that I play will look different, but it's still the same. So to be a part of that group, you still have to have those identities. So identify as a woman of color. But now as a faculty person, creating these kind of safe spaces and playing the role as maybe an advisor, a mentor, or a big sister, it looks different, but still the identities have to be in place. And so in psychotherapy, when there's a women of color group or a person of color group, and everybody has those identities, psychotherapy in the process, of course, focuses on any and everything. But what's not missed is that because of our identities, the intersection of those identities, our experiences in these states, in this country, is going to be unique in comparison to perhaps our white counterparts, right? And so then in the support groups outside of psychotherapy, it's the same thing. However, there's a layer or a dimension of activism that'll look different from a psychotherapy group. So the intervention and being in a space together and doing that work together is advocacy and activism in and of itself. But in the community group, we all had a shared understanding that from this space, working together, healing together, whatever that might look like, and supporting one another, that we're going to take this, create something, mobilize, and try to, create change. So many of variables was discussed. So while here at Xavier and working with a group called Trust, the focus was mostly on sexual violence. This group came together, and so if I can just be candid, this group came together post-Trump's first election. So these young women acknowledged that they felt invisible. They felt that the moving forward with this administration was going to be detrimental to Black persons, especially Black women. And so they wanted to come together as a collective, have faculty involved, because they also feared what this might mean for the university campus and how administration might miss and or not support them in ways that they needed. And so that was kind of the birth of Trust. And those two students are now off in graduate programs doing great things, but they still remain connected to Trust. So they came together, we came together, and so we talked about what this meant living in this new kind of space post-Trump, but also there was a lot of sexual violence that was happening on campus that the students felt was not being represented in the Clery Act reportings, that was not being discussed by administration, and that they were worried for their counterparts and themselves in regards to safety and support. So in addition to coming together to support one another and to bring in other community stakeholders, and me in my role being there to support, help guide, and possibly pass a blueprint for how do you mobilize on university campuses, they were able to come together, support, but also meet with the provost and some other persons to talk about what services they might need and changes they wanted to see. So that was the work for me being a faculty person, but also having a clinical background to be able to support those students that I've done here at Xavier. Some of the barriers that I encountered here, as well as other universities where it was to come together as a affinity space, was one. So at like predominantly white institutions, there's always pushback when you say, no, you can't sit here. Or when you tell people who are privileged, who are used to having access to everything, well, this is a space that you can't have access to. And so part of the training for me, but also working with students, so as a clinician back then, but also as an academic person, was how to engage those conversations. So there are spaces where we can all come together, multicultural spaces to have those conversations where we can learn from one another, but then having to communicate with persons who don't share that identity, because I was also approached by Black identified men and just men in general, that this is a safe space, so not a learning space. This is a space where people can come together and lean on one another and support one another. And your gaze and or being a part of this space can maybe disrupt that process. It's just safe and for them, but there are spaces on campus where we can all come together and learn from one another. So that was kind of the major barrier that I encountered at predominantly white institutions. At Xavier, which me and colleagues are writing up this process now for research, it was more so creating affinity spaces in places of perceived affinity. So to kind of break that down, being at an HBCU, a historically Black college university, the idea was that a space specifically for women of color, and even more specifically just for Black women, was not needed. And so having to have conversations with administration to, one, say that this wasn't going to be a student organization. So there's many kind of layers and rules that a student org has to follow. And these particular groups, these particular support groups wanted to have freedom, not necessarily to like break rules, but to be able to move and to mobilize and to do outreach and to connect with community outside of Xavier in order to affect change or to bring forward ideas to the university. So at Xavier, there's more of a student government versus like a student senate. And there isn't like a BSU which sits kind of alongside the student senate. So it's not necessarily under administration in the same ways that a student government is or a student organizations are. So they wanted that freedom. And so having those conversations with administration and my counterparts who are at other HBCUs who also have clinical background, who are faculty now, having those conversations with their administration were similar, that you don't need, you know, an affinity space just for Black persons or for Black women, because the school is Black. And many of those conversations were had between faculty and persons who did not identify as BIPOC or BIWOC or Black identified. So that was another one of the barriers that I encountered specifically for HBCU spaces or spaces where there's perceived affinity that is just for persons of color. But yeah, so I continue to do the work, especially in these next steps as I'm nearing, you know, finishing up licensure and stuff. I'm thinking about what practice will look like for me, and being able to support those students who want to continue to mobilize and create spaces that are just their own. So there's a lot of supports that have come into Xavier specifically, and I'm thinking about my time at Loyola and UIC in response to all of that. So being a clinical activist, scholar, however, whatever the names that people want to use. But so I'm thinking now about the next steps and what that might look like. So myself, venturing more so into the clinical world at some point, but also being an academic, and then what those services will look like on campus. But so for those who might be interested in doing this work, there are a few things that I would say are important to start. And so I wrote down somewhere the list. Yes, I got the list. So the list of things that I had to consider and that I had to learn and that my colleagues continue to kind of build on this list too. So the first thing that we had to do was a needs assessment, right? So even though a few students, and I lean more towards qualitative research and mixed methodology. So one person's story is enough for me, but also if we're creating groups, affinity spaces, psychotherapy groups that to address a certain targeted population, it's important to figure out what the needs are. So to some degree, we did like a needs assessment. We wanted to do a literature review because everything that we do in terms of clinical work is based in the science. And I say that I say it's based in the science, and that's absolutely true. But also to be aware that the science that also has us in mind. So populations in which things were normed on are very important. The same type of clinical tools that was used for a population that's predominantly white is not easily or cannot be transferred into a population that's a community of color, right? So we had to do a needs assessment, literature review, finding and figuring out where the gaps were. So is there something already created? So many of folk in this space are creating unique and great interventions to bring women of color, Black women together to build sisterhood and support and all of these great things. So we looked to see what was already out there and if there were some ways that we could tweak it to make it more applicable to the spaces that we were in at that time. And then very important, working with community stakeholders. And so that meant, in addition to me being wherever I was in space, being a clinician or being a faculty person or being both, that I worked alongside students and that there was an understanding that I'm coming with expertise, but they're living it. This is their lived experience. So they bring expertise too, and for that to be honored and affirmed. Working with partners inside and outside of the system, because it's good to make those connections, especially when we're talking about students who may not feel safe on campus or in their community. And so for them to have connections outside of that where they can, get that support and feel affirmed. And then figuring out what the intervention or what the affinity space might look like in the community that we're trying to target, right? So for us in Trust at Xavier, we knew that we didn't want to be a sanctioned organization because we needed freedoms and we wanted the power to be able to mobilize in ways that wasn't going to be halted or adjusted by persons who weren't a part of this community. And so as opposed to being a sanctioned organization, they wanted to connect with advisors who shared identity, so myself and other Black faculty that were women. And then for these two particular groups, because sexual violence was a big part of it, and which why we came together. So even the psychotherapy groups that I was doing that was focused on women of color, sexual violence was a big part of that as well, interpersonal, you all know what I'm trying to say, IPV, I can't remember my acronyms today. It's been a rough morning anyways. So that was a part of both of these spaces. And so as a clinician, which you all know, we, well, not me currently because I'm an academic, but clinicians are Title IX exempt if you're at a university, right? And then if you're in the community, you have privileges in terms of like confidentiality and those pieces. But as an academic, even my counterpart who is licensed and an academic, as an academic, we are not Title IX exempt. We are mandated to report and to send things up should someone report with detail what has happened to them that falls under the realm of Title IX, right? And so then we had to make that very clear and figure out what that would look like for these spaces too. And so that's the other encouragement, to figure out what it's going to look like in this space, and then what rules kind of govern the land that you're trying to bring this intervention to in order to create something that can respond to the need, but also allow people the most accurate and up-to-date information while keeping them safe. So I had to have conversations with students here that you can disclose and talk to me, but be mindful that if you disclose such and such, such and such, such and such, that I, as a faculty person, have to report. But yeah, so that's kind of a quick, maybe jumbled, all over the place kind of description of the work that I continue to do and that I've done, and that really fuels me, that I'm really passionate about, and that I hope, in addition to once I start building clinical practice, to continue or to go back to some of that psychotherapy work, especially with psychotherapy groups, because I love psychotherapy groups. I love individual work, but I really, really love psychotherapy groups. So that's kind of the work that I hope to go back to as well. But so that's about it in terms of what I wanted to share.
Well, let's open it up for questions. We have a good 15 minutes or so to have a rich conversation. Questions?
Oh, sorry.
I'll go first.
You can go.
So my question was just creating these safe spaces. So as you know, we work in the Gertown community, and Dr. Ashley already did a needs assessment, and that's why we're like creating all these attachments to the XUCOC, where we have like Reach Out and Moms on the Rise and things like that. but for like these safe spaces where that people can really come together and like have conversations and like these smaller groups, is it best to kind of like narrow like this specifics onto like the criteria of how you would be able to join each group, or is it best to have more of a like broad aspect group where it's like say like just having a group just for people that are of the GER community, but then also having a group that is um, women who are like young mothers, and then having a group where they're like working fathers group, but just like spacing them out, but also having this come together kind of community.
So what I appreciate about the work that you all are doing is that I think that's in play. And so I absolutely support that. And I see the benefit in having spaces for people to choose from, right? So having a group where everyone can come together, because in addition to just support, mental health, well-being, there can also be an exchange of, I'm learning from someone who is different from me and having a different experience, as well as now my support system is bigger. I feel more affirmed by a larger group. Now, some of those pieces can still exist in the more refined group or the more affinity space, right? So I think there's room for both. Again, it goes back to what I would say what is most needed in that time. And what the needs assessment kind of reveals. But if there is space for that, I support having both kind of large process support groups, whether they be psychotherapy groups and or just community kind of drop-in groups for support. But then also, so like, I think you said Moms on the Rise and some of those other things, I think that's phenomenal. So for those identities that have just their own, because they're going through a unique experience and have shared identity, that they too can also build relationships and feel affirmed, and have other opportunities to build support. So I think both are very important. And to go back to the needs assessment to figure out what that community really needs at that point in time. Yeah, great question. Yeah.
I was going to ask, is there a common issue or pattern that you notice when working with women of color?
Yes. So I would say yes. And I think sometimes it can differ across, I think there's some themes that across what I'm about to say, but in terms of like age and experience and responsibilities. But what I would say definitely with women of color, BIWOC community, is this sense of having to take everything on. So being responsible for everybody and themselves coming last. That I think is absolutely heartbreaking. And so creating these spaces where they come first is super important to me and makes my heart beat faster and feel warmer. But so I would definitely say that responsibility of taking on everyone else and putting themselves last, depending on where they are in their careers or in the world, the sense of not being seen and not being heard and not being affirmed, depending on what we're talking about in the group. So in addition to teaching, but also clinical work, part of my work, in addition to sexual violence, is also human sexuality and just healthy sexual relationships and relationships in general. And so then what is the narrative coming out around what it means to be Black woman, and affirming what they look like in relationships, who they are sexually, because there's a lot of tropes and caricatures out there around what is attractive or what you're supposed to be like in relationships. So that can sometimes come up as themes. But I would say definitely the first theme that comes to my mind across all these groups are that they come last to everything else, this being overworked and overlooked, and in that helping them to recover and reclaim their joy and to affirm who they are, and to put themselves first. So.
I'm curious about how do you see infusing activism into your clinical work once you get that started? I'm really interested in how you visualize that happening.
Mm-hmm. I'm very excited for that to happen. So let me say that Firstly, I would say, so when I think about like clinical interventions, I think about what's socially just in everything that I'm about to do, right? And so that could be everything from sitting across from somebody and doing traditional, but like African-centered, woman-centered clinical work with them, but also the focus of therapy might be my lights are off and I'm stressed out. So then that means my role is to figure out how to get them those resources to get their lights back on. We can't talk about the other things if you go home to a dark place and you're trying to figure out just how to survive. So that's where my mind goes when I'm thinking about clinical work in terms of being socially just. Um, and so in terms of what I see the next steps in the clinical work that I'll do that will also engage activism is creating those spaces. So I see those community kind of drop-in spaces and kind of dismantling some of these more, I would say, Eurocentric focus ways in which we engage and enter into therapy. I see psychotherapy being very, being its own kind of activism in a way. So providing those services to people who don't have access to them regularly. So that might mean sliding scale, free services, but then also being able to drop in. And so this kind of idea of like, let's just talk and trying to dismantle what it means to come into therapy and what therapy even looks like. And so working with community stakeholders too, to create interventions that will address the needs in the community that I plan to start practice in. That's one of the things that are on my mind as well. And also, so I'm thinking about in terms of like policy and what's happening in the world around us. And so responding to those needs. So I'm still working through kind of the specifics, but so interventions to me, depending on how they're framed and who I'm focusing on, can be activism in and of itself. I think therapy can be activism in and of itself, but definitely wanting to tailor and create opportunities to address those everyday living experiences where I can't keep my lights on, I need help with childcare, I can't find a job, that being a part of the therapy and hopefully a part of the space that I create. Connecting them with persons and or bringing in like social workers and other case managers to work with me to support, to provide like a 360 report support to those persons. I would also add to that though, and I'm still thinking through it. And so I'm talking to mentors and we'll be talking to you soon, Dr. Olatunji, in terms of, you know, I see mental health professionals, we have a lot of privilege. And so how then do we get messaging out in terms of like support and dismantling systems out there and being vocal about how racism impacts mental health, how sexism impacts mental health. And so I'm not one who uses a lot of social media, but I'm thinking about creative ways that mental health persons can come together and be a part of policy change and be very clear and open about where we stand in terms of how these things impact one's overall and well-being. So.
And if you're okay, I think that we should definitely talk. There are some common threads that exist in what you're saying and some things that I actually am actively doing as a mental health professional and as a clinician. So definitely, yeah, let's have some conversations for sure.
Okay, yes, I'll send well, Dr. Olatunji, can you, I don't know how to exchange emails in this. I think my email is already in there. I'm excited, please forgive me. Yes.
Yeah, no, it's really great. And you know, I was thinking, I went to, I attended a brief 1 hour webinar yesterday with actually that Dr. O led, and it was really great because it really helped to put into language the work that a lot of Black clinicians do without naming it. And so it really got me thinking about this idea of how do we take the work that we're all sort of inherently doing it, and how do we structure it, and then how do we put it out there so that it is formulated and that we're naming, like, no, what we're doing is we're talking about traumatic stress with our clients every single day, even when we're not using that language. And so because you have something like PTSD, where it's out there and people are naming it and there's this sort of consensus around it, the work that Black clinicians are doing does not have that. And we are all inherently doing that. And we need to begin putting in that language and those systems and saying that what we're doing is very much centered in understanding our identities, understanding the intersectionality of our identities, and that there's this inherent thing like activism that is infused into the work that we do. Even if we're not calling it activism, it is exactly that. And so we need to come together and begin to formalize that and do it in an evidence-based way. So yeah, so I think between yesterday and today, it's just really got my juices flowing about the fact that we're doing this work consistently, and we are not putting it on paper. We are not formalizing it. We are not researching it. We're out here doing we've been doing the work. Dr. O has been doing the work for years, and it's not out there. And we need to put it out there and say, this is what we're doing. So that's my rant. So yes, I think that we should definitely get together.